Qabayan Radio. Qabayan Radio. 94.3.
Qabayan Radio 94.3. It is now 6:32 on the clock, and I would like to say hi and happy listening to each and everyone. Right now, we are live on Facebook for our The Doctor Is In episode, and tonight we are going to be joined in by one of the consultant pediatricians at Ahli Hospital, Wakrah, Dr. Atiya Bashir, to discuss to us about child growth and development. A wonderful evening to you, Doctor. Hello, Doctor. How are you? Can you hear me?
Today I will be discussing.
Hello, Doctor. Sorry, we didn't hear you earlier. I would like to say hi and a wonderful evening to you.
Hi, good evening to everyone. I'm Dr. Atiya. Can everyone hear me?
Yes, we can hear you clearly now.
Great. So today I'm going to discuss the importance of well-child visit. As we all know that a lot of parents have a misconception that you should only be going to the doctor when the child is sick.
Mm-hmm.
However, sometimes the well-child visits are actually more important than the sick visit, because it's in the well-child visit that we discover a lot of issues that the child might be facing.
Right. So usually, when is the best time to have our kids checked? Because usually when we have newborns, they usually go to the hospital for some checkups, and they have these vaccines being taken like every few months. So how early should they be going to the hospital for a yearly checkup after all those vaccinations have been made?
Right. So from birth until 18 months, the babies get seen very often. First at 2 months, 4 months, 6 months, 9 months, 1 year, and then, 18 months. So
Right.
they get seen a lot of times. However, a lag time comes when the child turns 2. And from 2 until 4, since there are no mandatory vaccines, these kids are missed and they do not get seen routinely. So the best time to start yearly checkup would be at age 2 until the child turns 15. So yearly checkups are very, very important.
Well, you have mentioned ages 2 to 4. Why is it that you have mentioned a specific age of 2 to 4? Is there like anything happening in the growth or in the development of the child that is very mandatory for doctors to see for the doctors to see the children at that particular age?
That's right. Sure. So at age 2, in fact, at any age, we always like to measure the child's weight and height. And it's very important to make sure that the child is going through the growth chart as they were placed initially. The doctor will also check the child's blood pressure and the heart and do a full physical exam. These children then will be plotted on a growth chart, which includes their height, their weight, and their head size, including their BMI. So as you can see in this growth chart, we're comparing a child against 100 children. So the bottom is showing the weight and the top is the height. So the red marks show you that the child was following a certain curve up until age 1 and then started to drop off the curve for weight, for the height, as well as the head size. So
Right.
it is during this well check that we will discover what exactly is going on. Why is this child falling off from the 25th percentile until age 1 and now even drop to below the 3rd percentile? The head circumference is also very important. As you can see that the child was higher for the head and then just went down. So well checks are the best time to plot the child on a growth curve. Similarly, a child who is gaining extra weight or excessive weight can also be shown on the growth chart. As you can see here, that this child is now was following a certain curve and has suddenly started to climb. So as you can see that the weight from the 10th percentile actually moved up to the 95 percentile, as
Right.
well as the height. So this could be due to, simple obesity, that the child has been eating unhealthy food, or maybe an underlying disease that may be responsible. Excessive steroid secretion in the body can cause a sudden weight gain. So
Right.
all these, an increase in BMI, as you can see over here, a sudden climb or a sudden drop, both are very important that can be determined during a well check.
Right.
We will show you some more pictures of what happens during a well check. So the kid gets a blood pressure check, and oftentimes high blood pressure can be very silent. So the only time we find out that a child is having high blood pressure is when they come for a well check. And 3 years and onwards, each child should have a blood pressure checked every year.
Oh wow, that's
So 3 years
as
is the
early as 3
earliest.
years old they should be getting their blood pressures
That is
checked.
correct. Yes.
By the way, I
So
hope
at
you don't
least-
mind me interrupting you right now. I would just like to, for the benefit of all the listeners right now on the radio, I would like to tell you that we are actually on air right now on Facebook Live, and we are showing some diagrams, some graphs from our guest doctor, Dr. Atiya. So if you would want to see those presentations, please do head on to our Facebook page and watch the online presentation that we are having right now. And yes, we are discussing about the BMIs and the growth of the children a little early. I would just like to ask, Doctor, how early does it start when kids, start to speak or develop their speaking or language skills?
So babies communicate with their parents as early as when they are born. So babies look and focus on a human face, which offers a very good contrast. They also look at bright colors like red, white, and black. So any baby who's not having an eye contact with parents, is not focusing on the colors or on the face, could be a very early red flag. The babies also communicate by cooing, and cooing can start as early as 3 weeks, 4 weeks. So any baby who is not looking at the parent and does not have a social smile or is not cooing by 8 weeks could be a red flag. The communication can be by expressive language as well as receptive language.
Right.
So by 9 months, the child should be babbling. At 4 months, most kids smile and laugh and giggle. And by 1 year, they should have at least 2 meaningful words other than mom and dad.
Right.
So any baby who's not babbling by 9 or 10 months and not speaking meaningful words by the age of 12 to 14 months is a red flag.
Okay,
Similarly, a
so by 12 months or 14 months, parents should already be concerned, and they should already seek medical attention to have their kids checked whether they are, their kids are having some development issues in terms of communication.
Absolutely. And there are 2 types of languages. One is the spoken language, and the other one is a receptive language. So if a child is not responding to simple, requests by the parents, for example, called by his name and not turning or responding to his name, is again a very big red flag. So a child who is not speaking should always be considered to have an underlying problem, which could be in hearing or other issues like autism, in which there is a significant expressive delay, poor eye contact, and the child does not turn to his name. So all these forms of communication in which the baby responds to his environment, to his siblings, to his parents, if any of that is not following the way it should be, the doctor should be notified, and the next course of action should be taken, which should include hearing test, a formal hearing test.
Right. That's why it's very important to get the kids checked regularly, right? For them to be for the doctors to be able to assess the development of the children. And you were mentioning, apart from identifying their what do you call this progression in terms of developing their spoken and receptive language. You were mentioning earlier that during the examinations, the yearly checkups or the regular checkups that they have to go through, you are trying to identify the weight of the children, the length, their length, the size of their head. You are checking their blood pressures as well. What else do you check, for those kids that are in that toddler years?
So those toddler years, we also make sure that we check regarding their diet, because healthy nutrition makes healthy minds. So if a child who is eating unhealthy food is overindulging in processed foods develops significant obesity, which is evident by the body mass index,
Right.
which goes really high. So nutritional history is really important, and good health habits are obviously promoted from very early infancy. So we advise parents to introduce all the varieties of fruits and vegetable, and if parents are non-vegetarians, they can also introduce poultry and fish, as well as red meat in reasonable quantities. And the diet should always be composed of a balance of carbohydrates, proteins, and fats in a certain proportion. So the child should have about 30 to 50% carbs, and carb source should always be non-refined, non-processed carbohydrates like whole wheat should be preferred on white flour, as well as the brown rice and the brown pasta, which has the husk in it, which is also is more healthy than those refined sugars.
Right.
Similarly, protein, high quality protein is present in eggs, meat, fish, milk, and eggs. Eggs are very good source of good quality protein, as is lentil.
Right. But I would just like
Healthy.
Yeah, I'm just wondering, comparing the kids nowadays from maybe 10, 20 years ago, has there been like a significant impact on their health about what they eat? Because I'm sure that most of the food that are available nowadays have some effect into how our children are growing right now. So is there like a significant difference about what we eat nowadays or what our kids are eating nowadays compared to maybe a generation ago?
Oh, absolutely. There has been a tremendous surge in fast food culture. And the reason being that the fast food is advertised and promoted much more than the healthy food. It also is a little cheaper, and it's readily available, and it's just a phone call away. So
Right.
Unfortunately, the fast food culture has totally taken the society in a big way.
Yeah, and I can see that even for kids, even for babies, there are like already pre-packed meals for for as early as a few months old. So I don't know whether that's having a huge impact on their development and as well as on their BMI, as we were talking earlier.
It definitely is, because fast food is rich in very bad quality fats, carbs, and it's very devoid of protein. So the children actually grow fat, but they don't grow physically, because the protein is very good quality protein is very important for our healthy growth of a child. So this is a cartoon that shows us with the fast food culture, the BMI has shifted to the right, and the obesity is actually 1 out of 4. That's how much it is present in our community. 1 out of 4 child is obese. On the other hand, when we do not eat healthy diet, the child also can develop malnutrition. So you see that this child on the top has a very, very low BMI, which means that he's not getting enough nutrition at all.
Right. Yeah. So I would just like to know, because apart from the food that they do eat, many of the kids nowadays, I can notice that as early as a few months old or a year old, they have already been stuck on their screens. I don't know whether this also affects the development of our children in terms of their communication and as well as physically their movements and all that stuff. So how does this affect our kids nowadays, their screen time? Because many parents, for them to be able to, because many parents are also busy with their day jobs, and both parents are usually working nowadays, and when they get home they're tired, and when they have the kids, usually they just allow the kids to go online and watch YouTube videos or whatever. Does this affect as well their health as early as a few years old?
Yes, so I have seen kids addicted as early as 9 months of age.
Wow.
And screen, yes. So screen is the worst thing that you can offer to your child under age 2. The only time we allow screen time is if you're video chatting with family that's far off, because that involves emotions. The child can react to the person who is actually talking to the child. However, exposing children to programs like cartoons can cause severe addiction, and this can affect their development. These are the kids who do not relate to emotions. They actually develop antisocial behavior. They relate more to the cartoon characters than to the parents and siblings. And because they are confined and they are just glued to the TV, they do not get any physical activity. They do not go out and play and interact with their peers. As a result, they can develop obesity and they become like couch potatoes. So sitting in front of the screen also promotes unhealthy eating and fast food culture. So everything is actually interrelated. More screen time, but more weight gain.
I'm just curious, doesn't it help for the kids to watch a lot of educational cartoons for them to develop their speech and their communication skills? Or is it still better that people talk to them rather than just learning how to communicate through the videos that they do watch?
So there's been a lot of studies that have been conducted of the effect of screen time and all these so-called educational programs for children, and it's been proven that children learn by interaction. They learn from parents, they learn from siblings, they learn by activity and communication rather than just watching a program. In fact, a lot of kids come to me showing signs of expressive language delay because they have been watching so much TV that they turn into a robot. And toddler TV viewing or screen time has been linked to symptoms of autism. So screen time does not help in language development at all. It's a very big misconception on part of parents that if my child is watching cartoons or watching programs that he's actually learning. The true reality is the child actually loses expressive speech, does not feel the desire to talk, versus a child who is taught language by actually speaking and communicating verbally and in person.
That's very good to know coming from an expert, because most of the times we are always, provided by marketing material saying that this particular program, this particular show would help your kids into learning new things and all that stuff. But you are saying that it is still much better for kids to interact with adults or with anyone, basically physically, compared to just learning through the videos that they do watch, because apparently this can cause some issues in terms of the delayed development, and that could also pose some concerns in terms of developing autism and all that stuff.
Absolutely. It has been linked to autistic type behavior in toddlers. And my advice to parents, if they want to watch a program or a nursery rhyme with a child, please don't put it on a repetitive manner without being physically present there. If you want a child to watch something, be with the child and sing with the child and talk to the child. And after the nursery rhyme is over, you can actually ask questions and help the child interact with you and answer your question. This makes it more interactive and educational for the child.
Well, I do have a question here on our Facebook page coming from Mr. Osama Zakut, and this is something related into communication, I guess, with the children. He is saying that perhaps this is the reason why he's asking this, because many people are so busy nowadays. Parents, just tend to leave their kids with nannies. Would it be recommended to have the kids go to nurseries at under age of 2?
So for me, the only downside of sending the child to nursery is that your baby will be bringing a lot of viral infections, which is fine. That's relatively easy to handle, rather than the child being exposed to excessive screen time. So most of the nurseries nowadays are very well equipped with a lot of educational toys. The screen time has been totally banned. Parents can actually watch on the camera what their child is doing, and they do interact with other children. There's a lot of reading time and play time. So for me, it's all positive, other than that the child will bring more viral infections,
which is actually good sometimes, because that can also boost their immune system, right?
That's true. A normal baby can develop 6 to 7 viral infections per year, by the way, which is completely normal. And that's how their immune system learns how to identify and form immunity against the viruses.
You keep on mentioning about the screen time earlier. I would just like to ask, just in case the parents would allow their kids to have some screen time as early as like 2 years old, what is the longest time that they can have their kids to, go on their iPads or iPhones to watch some videos?
So total screen time, which includes iPad, iPhone, and TV. Some people do not consider TV as screen time and only iPad and iPhone, which is wrong. So my suggestion, maybe 2 and 3, under 2 years, there should be no screen time. Between 2 and 3, they can spend around 15-20 minutes supervised screen time, but nothing after sunset, because the blue light which is emitted from these gadgets actually interferes with the sleep cycle. So these children who are watching cartoons or programs after sunset, they also have a very erratic sleep cycle because of this blue light, which does not allow the sleep hormones to be released from the brain. So maximum screen time allowed for children and young adolescents or in early childhood is maximum 1 hour, 1.5 hour, which includes all the screens put together.
All right. So 1 to 1.5 hour, that's inclusive of your iPhone or your phone, a tablet, and including television. And for kids 2 years old and below, there should really be no screen time at all.
No screen time at all. You have to read with your children. You have to sit them down and talk to them and read to them as early as when they are born. So reading should start.
Right, and because it's also very important for kids at that particular age to have an ample time of having some sleep, right? Because that also affects their growth. So usually, how long should newborns up to age 2 sleep in a day?
Well, newborns, all they do is just eat and sleep, and they sleep round the clock. Children who are, at 9 months of age, they should start sleeping through the night. No milk or no food should be ordered unless they demand it. So we can allow our infants to sleep through the night, which starts at 7:30. From 7:30 until 6, they can sleep without being offered any food. Certainly after 1 year, there should be no milk, no milk in bed, no offering of bottle, no formula. So they should sleep 11 to 12 hours at a stretch.
Wow. So that's quite a long sleep. I wish I was a baby. So I have an excuse to have that kind of long sleep.
Yes, and a short nap in the daytime, but no nap should be after 1:30, maximum 2 p.m. Because that's the time between 2 and 5:30 that they should be very actively playing and getting tired. Right. No nap should nap should not continue until 3, 4, or 5, because in that case, their sleep at night will be totally, disrupted. They won't feel like sleeping because they've had a very late nap.
Just going back to the conversation that we were having earlier regarding the physical checkups, you were mentioning about the food that we should be mindful of. I would just like to check, since we've already discussed some of the carbohydrates and the fruits and all the vegetables that they should be eating. How advantageous is breastfeeding, first and foremost? How advantageous it is for kids, and how does it impact the child's life in general?
So World Health Organization recommends exclusive breastfeeding for the first 6 months of life, with solids being introduced around 5.5 to 6 months. This is a complete nutrition for the baby. Apart from vitamin D, they don't really need much. And breastfed babies are considered very healthy. They are protected from obesity, having high blood pressure, from type 2 diabetes. They're also protected from food allergies, asthma, eczema, gastroenteritis, ear infection. Even the emotional well-being of a breastfed baby is far superior than bottle-fed babies. So breast milk is the best nutrition until age 6 months, exclusive breastfeeding. And after that, the breastfeeding can be decreased and the solids can be introduced. And the recommendation of World Health Organization and American Academy of Pediatrics is 2 years of breastfeeding.
2 years of breastfeeding. So what is your recommendation? Because there are so many parents, especially moms, who are also working. Like after a month or two after they gave birth, they return back to their work. What is your suggestion on how they can manage breastfeeding their children up until 2 years old?
So breastfeeding, once established, gets easier and easier. I know a lot of moms are, very anxious about going back to work. I recommend those moms to start pumping early. They can see a lactation consultant. A lot of professional moms that I know have successfully breastfed until age 2. They did not introduce formula and they pump at work. There are, flexible hours for breastfeeding moms. They have most of them have been provided with a place where they can go and they can pump. So breast pump and being convinced that they want to breastfeed. To me, and also the society is now getting very conscious that breast milk is the best for baby, and breastfeeding moms are being given a lot of help by the society and at workplace.
And they can also keep their the milk stored in the fridge for a certain period of time, right?
Oh, absolutely. When they pump and they have extra, they can store the milk in the fridge for 2 days. They can actually freeze it for 4 months.
Oh, wow.
And yes, the breast milk can be frozen for 4 months, and they can put the date and time, and then they can continue to thaw the milk. And even if they are not there, the caregiver can actually thaw the milk and give the breast milk when mom is at work.
So there's no more excuse not to breastfeed your kids.
There is no excuse.
Well, that's those are really good suggestions, especially for kids nowadays, for their development, given the the food that we have right now. It's something that sometimes it's scary, right? That we don't know what's in our food. But anyway, I would like to ask these questions that we have been receiving on our Facebook account. And this one is coming from May Benny. And she's saying that due to the pandemic, most parents put their kids on a remote online studies. Any advice for parents, as I noticed that many kids are getting lesser attentive if I call their attentions? I need to tap their shoulders. That's again a question from May Benny.
So, sorry if I understand wrong. The question is that what do we do for the remote or online learning that has been imposed upon us because of the pandemic? Well, you know what? I would say that blended learning, go for blended learning if your child does not have any chronic illness, or the family member does not have any illness that poses a danger for child attending school. And as much as possible, the child should have very short breaks, and during those breaks the child can have a healthy snack, maybe just take a stroll around the house. So a little bit of physical activity is better than none. And also it's very important to cut down on the social social use of screen time. So we must make sure that even during this pandemic, little bit of physical activity. You can even have physical activity, within your household. There are a lot of games that you can design within your household in the limited space where the child gets to be active.
Right. Here's another question. This one is coming from Ms. Ruba Momani, and she's saying that the separation anxiety caused by leaving a child in a nursery alone have any long-term effects on children's mental and psychological well-being in the future?
As far as the studies go, it seems that if the parent or the caregiver is spending whatever quality time the parent gets with the baby, is likely not to have an adverse effect on the child who's attending nursery. We see a lot of happy kids who were actually attending daycare from very early age, because when the kid finally comes back home, they get to spend quality time with the parent. So the quality is more important than the quantity. And I've seen a lot of kids who actually are at home, but the parents are not paying attention. They're mostly involved with their own social activities or more attached to media than the child. So it's not your physical presence with the child 24/7. It's actually the quality of time that you give to your infant or your child determines his mental well-being and can handle the separation anxiety, which is separation anxiety is a very normal thing that develops at the age of 9 to 18 months.
But would it be okay if, like for example, I do have a child and I'm going to bring my child into one particular nursery this week, and then like after 2 weeks maybe I'm going to transfer the kid to another nursery, and then after a few weeks I'm going to transfer again? Would there be a difference in terms of the anxiety of the child when you move them from one place to another, or being exposed to different environments, changing that kind of environments every now and then?
Yes, I would say continuity of care is really important, because the kids are very sensitive towards their caregivers, and they also develop an emotional bond and attachment with the caregiver. So it's very important that we find a nursery where the child, can continue the care rather than moving from one place to the other, which surely can add to the anxiety for the baby and affect the emotional development if the continuity of care is not maintained.
Okay. There's another question. This one is coming from Falestino Basumi. Does premature affect baby development? If yes, until which age? Or until what age?
So we usually correct babies for prematurity until age 2 in terms of their growth and development. Premature babies are definitely liable for some complications like even obesity, developmental delays. Autism is more common in premature babies. So we do correct until age 2, but after the age 2, they should have caught up with babies who were born at term. So it's very important not to overfeed your premature baby, thinking that because he was premature, and also all the care that a term baby is getting should be done for the premature baby as well, in terms of reading and stimulation of their visual and talking to them and speaking to them, and also making sure that they get age appropriate treatment from the parents and their caregivers.
So usually we're saying that usually it's corrected by the age of 2, but then of course it's also advisable for parents not to overfeed their youngsters, especially because they're thinking that they might be premature. They need more nutrients, they need more food, and what happens is that they become obese, and it's actually a more concern.
Absolutely.
So,
and one thing that I would like to mention here, is the use of formula after the age of 1 year. The World Health Organization does not promote formula feeding after the age of 1 year. A lot of parents have been emotionally blackmailed by these commercial companies and are forced to give formula to children who are age 2, age 3, especially the premature babies are getting high calorie formulas. The result of which is definitely obesity. So we must introduce healthy food, natural foods to children, and avoid the complications of overfeeding.
Right. I do have one last question. So this one is, the question is, how do I know if my child is developing normally or if he or she needs help? This is a very big question, but yeah.
Yes. No, this was the exact reason why we presented this program, is the essence of well check. So each time you go to your pediatrician, they'll ask you age-appropriate questions regarding growth and development. So if your child is missing out on certain milestones, for example, if the child is not babbling at age 9 months or not speaking at all at age of 1 year, this is the time when diagnosing early and early intervention helps. So the sole purpose of well check is to diagnose a hearing problem, a vision problem, a behavioral problem, so they can be addressed early, which definitely makes a huge difference versus any of those things diagnosed later in life.
Okay. Sorry, but I do have one last question. I was saying that I have a last question earlier, but this one is the last question. Will being bilingual confuse my toddler? Because of course here in Qatar, we are in an environment, in a multicultural environment, people from different places, and most of the people are speaking in English, in Arabic, and other languages. So will it confuse toddlers if we talk to them in different languages, or should we stick first on one language until a certain age?
So kids are very receptive to multiple languages, and they learn languages even better than adults. So, I mean, I have kids who are 3 years old and they perfectly understand 3 languages. So it's been proven that kids learn language very quickly, and sometimes we do notice that the child may have a lag period where they're not expressing as much because they've been exposed to multiple languages. In that case, I advise one parent to stick to one language, whichever they are good at, and the other parent can speak the second one. But eventually, if there is no underlying problem, most of these kids end up they become very fluent with 2 or even 3 languages.
All right. Thank you very much, Doctor. And I just want to ask you, just before we wrap up this particular segment that we have here at the Doctor is in, is there any final recommendation or suggestion that you would like to leave our listeners, our viewers right now, especially those who have kids as early, toddlers and infants, and how they can ensure the growth and the development of their kids are developing normally?
So I recommend that each child after the age of 2 should be regularly seen by a pediatrician. We are offering a very subsidized rate of about only 50 Qatari riyals at Wakrah Ahli Hospital, where the children will go through a full growth and developmental assessment. This way we can diagnose failure to thrive and obesity very early in life. Also, they will get their blood pressure checked. We have department of dentistry where dental care will be monitored, and if they are developing cavities, they can have a fluoride paint early, which will prevent the development of full-fledged dental caries, which can really be difficult to handle. It causes a lot of pain, and the child can't eat healthy food. So anticipatory guidance, prevention is
Right.
the only way to raise healthy children, which can be guaranteed by regular well checkups.
Mm-hmm.
So I recommend each parent to make a well check appointment for their children 2 years and above,
Right.
once a year, and get all these things done.
That's very good to know, especially that the checkups at Ahli is very affordable. Only at 50 Qatari riyals, they can already get all these assessments from experts like yourself.
That's correct. And also, I would like, we did not touch the subject of immunization.
Yeah.
During the pandemic, a lot of children have fallen short of their routine vaccines. And I think that now that things are getting better, it's a good time to catch up on the routine vaccines. And the well child care will also ensure that any vaccine that has been missed during the pandemic can actually be administered.
Oh, thank you for that information. And once again, thank you very much for joining us tonight.
Yeah.
And of course, we have our guest this evening from Ahli Wakrah Hospital. And this is the consultant pediatrician, Dr. Atiya Bashir. Thank you very much for joining us. And as she had mentioned earlier, it is always best to have a yearly checkup for our child as early as 2 years old, so that we can ensure that they are advancing and developing normally. And of course, you can go to any clinic of Ahli Hospital, and you can go and visit Dr. Atiya at Wakrah, so that she can assess your kids. So is there like any final words that you would want to leave our listeners, or maybe you have some friends or family members who are listening or watching to you right now that you would want to greet? Let's have this opportunity to greet them.
Hi, everyone. I'm sure that I have lots of parents and children listening to me, and some of them know me for a number of years. So I just want to say, hi to everyone. I hope everyone is healthy, happy, and trying to make the most of, whatever is happening these days. And the school is open, so let's have a very healthy school year and focus on healthy snacks and healthy breakfast at early bedtime, and avoid screen time, and try to get some physical activity.
Thank you very much for that wonderful reminder, Dr. Atiya Bashir, a consultant pediatrician of Ahli Hospital, Wakrah, who provide us some information on routine child examination, especially for the development of our kids, and which is very important nowadays during this time of pandemic. So again, thank you very much for your time. And just in case you are listening to us right now and you are watching us, you can always go and visit Ahli Hospital, Wakrah, for you to be able to avail of their services, particularly for the well-being of your kids. And as Dr. Atiya mentioned earlier, as low as 50 riyals, you can already have your kids checked. And once again, my name is Kenzo, together with Dr. Atiya Bashir of Ahli Hospital, Wakrah. For The Doctor Is In, I do hope you have a wonderful evening. Thank you very much for joining us tonight. We will see you again for the next episode of The Doctor Is In, only here on Qabayan Radio 94.3.
Thank you.